he's a crazy conspiracy theorist anti-vaxxer, right? I can see where they're coming from, but this is willful blindness. Several bits of data started to paint a picture that there was likely at that point, so this is now me in November 2021, GB News didn't come to me, I went to them, right? I've got good relationships with journalists, and I said, listen, there's a great story here, and it's important, and we need to talk about it. And I was a little bit nervous, with some of these things that I do. There isn't that I'm completely fearless, not at all, but it's about, if you have the fear, you have to conquer it and just get on with it. So I went on there and said, listen, this needs to be investigated. And at that point, very, very interesting, that's when in the UK they introduced vaccine mandates for NHS staff, and I thought, this is so odd. We now have some good data suggesting there's harm, right? Certainly the last few months. We know it doesn't stop transmission by those days. Why are they mandating this vaccine? Something's going on here. And then I campaigned, and I was on mainstream media talking about my dad's ambulance delay, because that became a big news story. And it kept getting in there. Pharmaceutical, we need to stop these mandates, it's unethical, right? And what do we know when we look back at the data? So, I think data evolves and data emerges which is higher quality and more reliable. And I was waiting for the opportunity to see what data do we have that at least can convince most of the medical establishment that there's a problem, right? I knew that I had to set my bar high, that we have to do that, and I can only do it for a medical journal. So I reanalyzed all the data that I had available at me at the time. I looked at cardiovascular risk in particular, and of course, first and foremost, the original trial from an absolute risk reduction only showed you need to you need to vaccinate 119 people to prevent one COVID infection. The RCT data itself didn't show statistical significance for reducing all-cause mortality or COVID mortality. So, okay, well, that isn't that great. It wasn't a small study, it was a large study. I've spoken at length, Robert is an expert on this, not me, but one of the things that many of us believed, many doctors believed, I even tweeted it out a few months after, I got sent an antibody test kit, and I tweeted out, and I was a bit like, is this vaccine working? Oh, my antibodies are positive, it's working, that's great. The FDA, how many people knew about this? In May 2021, the FDA actually put this out, it wasn't publicized, right? That basically antibodies are not reliable in helping people understand their level of immunity or protection from COVID-19 at any time, and especially after the person has received a COVID-19 vaccine. So I talked about absolute benefits and risks, so could we somehow estimate the absolute benefits of the vaccine? So I did an analysis in my paper, and we looked at the Delta wave. I worked with another data scientist, Claire Craig, over 4 months, so during a whole wave in the UK, to look at, and this is non-randomized data, so likely an exaggeration. There's a healthy user effect, so many people who didn't get vaccinated were high risk, right, especially from low socioeconomic backgrounds. But in essence, you had to vaccinate, at best, 230 people over 80 to prevent one COVID death, 520 if you're 70 to 90, and then you talk about thousands. If you're under 50, 10,000, right? This is, again, likely best case scenario. And Ioannidis also said this, that these non-randomized studies, certainly these claims around the world about 20 million lives have been saved, it's based upon some of the lowest quality level of evidence that we have. But that makes the headlines, okay? And the higher quality evidence doesn't make the news, so people are getting misinformed about these benefits. And then healthcare news reporting, of course, the misinformation mess is exacerbated by the mainstream media as well, and that's a big problem. Analysis into the United States shows that of 5 or 10 criteria for the accuracy of medical journal or medical reporting were unsatisfactory. So a lot of information that we receive, even doctors, comes from the mainstream media, but the mainstream media, most of the time, are not accurate in the way they report on these health stories. Just one example, just to show you how bad this is. So I got a call from a general practitioner friend of mine who'd read my paper and said, Aseem, this is very interesting, but maybe cognitive dissonance. And he rang me, he was polite, said, oh, are you sure, Aseem, it's the vaccine that's causing cardiac arrests and heart attacks? Are you sure it's not COVID? Have you seen the headline in the Times? So I looked at the headline in the Times, even mild COVID linked to heart disease and strokes. So I thought, okay, let me look at the research paper and figure out what is it exaggerated? Is there a small risk? Who we're talking about here? So I looked at the paper. First of all, the conclusions. Individuals hospitalized with COVID have an increased risk of cardiovascular events. And we knew this already from the Wuhan strain. You've got cardiovascular disease, any stress on the body. I've managed so many people with heart attacks in hospital, right? Pneumonias, whatever else, is going to trigger heart attacks in people who may be predisposed. So this is not new, right? And he said the risk of most events is highest in the early post-infection period within a month of being hospitalized. Individuals not requiring hospitalization have increased risk of pulmonary embolus, but not other cardiovascular specific. So the conclusion said, if you've got mild COVID, first of all, there is no increased risk. What else did they find in the paper? In our main analysis, we found an unexpected association of COVID-19 with lower risk of incident MI in the non-hospitalized subset. They found if you had mild COVID, you were less likely to have a heart attack. Now, they can't explain it, but still, come on. Okay, and they also said, in all of our analysis, we didn't account for potential vaccine status. Right? But that headline, that lie, Winston Churchill said, a lie can travel halfway around the world before the truth has got a chance to put its boots on. Right? This is what we're dealing with. Can we trust the regulators? Unfortunately, no. Why? One of the main reasons, they're mainly funded by pharma. 65% of the funding of FDA in the US comes from pharma. In our country, in MHRA, and the BMA, chair of the BMA did not know this when I told him. He was shocked, he didn't believe me. 86% of the funding comes from them. And what's the issue? Well, Donald Light says they're selective, they withhold data, they're not independent, right? And and doctors and patients must appreciate how deeply and extensively drug regulators cannot be trusted so long as they're captured by industry funding. What about side effects? Well, the best available evidence is Pfizer and Moderna's own RCT data, reanalysis, peer-reviewed, journal Vaccine, Joseph Freeman, lead author, I've spoken to him at length. They found that the risk of serious adverse events from the vaccine, from the original trials with the Wuhan strain or ancestral strain, was higher than being hospitalized with COVID. If that is true, and it likely is, and that was about 1 in 800 of serious adverse events within the first 2 months, likely an underestimate, because they tend to design trials where they take lower risk people for side effects for obvious reasons. The other reason is many other side effects happen months later. And Norway, interestingly, has replicated this data almost similar to this, and they had a rate of serious adverse events specifically of 1 in 926. The World Health Organization put out a list. We didn't know about it. Doctors should have been given this list, right? When the vaccines were approved, these are the potential serious adverse effects that could happen because of the vaccine, based upon other vaccine data, the platform being used, COVID itself, and animal studies, right? And everything and anything that can go wrong with the heart is on this list. And this is what we are seeing. And I am personally managing people where I've made this diagnosis of vaccine injury, right? This should have been given to doctors. And again, we've got good quality observational data showing increase in heart attacks and cardiac arrest in people aged between 16 and 40, so younger people, which was associated with the vaccine and not with COVID. That's from Israel. 30,000 excess deaths due to coronary artery disease, according to the British Heart Foundation, which they say is no longer now linked to COVID. Not sure what's causing it. So ultimately, I concluded, and for lots of reasons, that there should be a suspension of the vaccine. And also, historically, we know that we've suspended other vaccines for much less. 1976, swine flu vaccine suspended for causing Guillain-Barré syndrome in 1 in 100,000. And then 1999 rotavirus vaccine suspended for causing a form of bowel obstruction in 1 in 10,000. We've got at least 1 in 800. What is going on? Now, they're not acknowledging it. I spoke to Joseph Freeman, the lead author on that paper, who had actually spoken to the FDA, and I said, Joe, what's going on? He said, Aseem, they're kind of like, oh yeah. They're kind of saying yeah, but they're not publicly acknowledging it, and they're kind of ignoring, they're not doing anything about it. This is just shocking beyond belief. Okay, let's go back. I've got about 10 minutes left, I think. So let's just get into the root cause a little bit more and then talk about some of the backlash. So we have to understand, if we go further back, what's going on, what's driving this at the root. So there's a great concept called the commercial determinants of health, and it's defined as strategies and approaches adopted by the private sector. This can also apply to big food, by the way, the food industry, to promote products and choices that are detrimental to health. Now, this is a really nice framework of showing how the dimension, vehicles, and practices of big corporations, multinational big corporations, and how they exert their power, okay? So they have power over decision-making and control over the political agenda. Think about capture of politicians, lobbying, for example. They have power to define issues and potential issues, preference shaping, capture of the media, philanthropic organizations, okay? Bill and Melinda Gates Foundation, heavily invested in McDonald's, Coca-Cola, and pharmaceutical industry stocks. The second biggest contributor to the WHO now. Margaret Chan, the former director of the WHO, recently said 70% of the funding from the WHO comes with strings attached, right? The WHO are not being independent, unfortunately. They're being influenced by these commercial entities. They capture the knowledge environment. So funding medical education, funding medical research, the legal environment, limiting liability, okay? Pfizer were able to get waivers from many governments across the world that if there was damage done to people, if there were vaccine injuries, we are not liable. And then extra legal environment, which we'll come on to in a minute. Opposition fragmentation, okay? People who are calling out, pardon my language, people who are calling out their bullshit, right? They get smeared. They get, their credibility gets attacked. This is not by accident. This is all part of this framework, this corporate playbook, okay? And because they do not want to get this into the public's attention through mainstream media, that's why they capture mainstream media. And this is power to avert conflict and keep conflict latent, conflict between the interests of the powerful and those over whom power is exerted. The general population don't know what's happening, and they don't even know that they don't know. So, I've only got 5 minutes, so I'm going to go through this quite quickly, but basically corporate power needs to be a public health priority. Just to give you an example, Vioxx, anti-inflammatory drug, Merck were fined $950 million in 2011 because it was found they committed fraud, double the risk of heart attacks, responsible for more deaths of American citizens than people that died in Vietnam, 60,000 people ultimately. But it wasn't a mistake. They knew pretty much at the time it was approved. Internal emails with a senior Merck scientist said, it's unfortunate about the cardiovascular effect of this drug, but we will do well and the drug will do well. What do you call this behavior? Well, the eminent expert in his field, Dr. Robert Hare, forensic psychologist, actually says that quite often the way that the big corporations work in their pursuit of profit fulfills criteria for psychopathy, okay? Callous unconcern for the feelings of others, incapacity to maintain enduring relationships, reckless disregard for the safety of others, deceitfulness, repeated lying and conning others for profit. So I've come up with this new term, which Richard Horton mentioned in an editorial about my talk, actually, interestingly, in The Lancet. I'm calling it the psychopathic determinants of health. We've got the commercial determinants of health, but we've got the psychopathic determinants of health as well. And if you think about this at the very root of the problem, it also explains a certain culture that can develop amongst academics turning a blind eye when things are harming patients, for example, regulatory capture, governments, etc. When Anthony Fauci said trust the science, in effect, I'm not saying he did this deliberately. I believe in the goodwill of most people. I think he's ignorant. In effect, he was saying trust the psychopath, and we know what that's done. That was a very, very bad idea, wasn't it? Okay, just finishing up now. So I've also personally been affected by these system failures. I've had personal loss. Both my mother and father died in different circumstances, quite horribly, because of system failures that have put so much pressure on our National Health Service that we can't even cope. What do we do to actually solve this problem? This is a great concept called the triangle that moves the mountain. And this is something I've been using, okay? So it's important that we make sure that the evidence is independent, is correct, and then we transmit that evidence to the public, okay? Social movement, and that influences also the politicians. And strengthening all of these three things together is how we move this very difficult mountain to move. But we can do it for sure, and we're getting there. And as a public health advocate as well, one of the things I also learned, is that, careers are often built, we have to understand, on a lifetime commitment to a particular phase of evidence, but if the evidence changes, it is absolutely critical for public trust in the integrity of public health that we acknowledge the facts have changed, and accordingly that we have changed our minds too. Media attention on a public health issue is often more effective than private advocacy in winning policy change. Sunlight is a very potent disinfectant for malodorous health policy. Okay? And mainstream media still has the biggest impact. Now, social media is having a good movement at the moment. We have to try everything we can to get the truth out. Elon Musk opening up Twitter, I think, has been a good thing. But one of the other things that we have to understand as well, we have to go rhinoceros hide, because as soon as your work threatens an industry or an ideological cabal, you will be attacked, sometimes unrelentingly and viciously. And I've had this several times in the last 10 years, okay? A government body, I helped the deputy leader of the Labour Party. He came to me, he lost 100 pounds. He tried to struggle with weight for many years from following a diet plan, which I recommended, which is real food, devoid of ultra-processed food. And then when I was trying to challenge our dietary guidelines and talk around in different hospitals, the chief executive of a government body called the hospitals and said, don't let Aseem Malhotra speak. The Sunday Times exposed it, which was good, and then they backed off, right? I then got accused of being a deadly statin denier. in the front page of the Mail on Sunday, and they said there was a special place in hell for doctors like me who claim that statins don't work. I never say statins don't work. I'm all for ethical, evidence-based medical practice. But this is a kind of smearing that goes on. So you have to just be tough, right? You've got to expect what's going to happen. But actually, this is a sign of progress. More recently, as you may know, I accidentally started talking about the vaccine on BBC News. And it's really extraordinary the lengths they've gone to. I mean, it's almost laughable. People would think I'm really upset. I was kind of like, hold on a minute, you know? I'm apparently an anti-Semitic groomer, right? According to the Times. And then The Guardian. And I've written 19 opinion editorials for The Guardian Observer that's influenced policy, right? This is the ridiculousness of the whole thing. Now, I don't know this guy. I'm an alma mater of Edinburgh University. I'm very proud to go to that medical school, right? So this is Mark Dweck, I've never heard of him, chair of clinical cardiology at the University of Edinburgh, told The Guardian, I think that Dr. Malhotra's opinions on both statins and COVID vaccines are misguided and in fact dangerous. The vast majority of cardiologists do not agree with his views and they are not based upon robust science. Disregard his views. He does not have a cardiology career to speak of. You might say, somebody constantly said, Aseem, they're saying you're not a cardiologist. Really? What? I didn't even see this. I was like, oh, that's interesting. So this is the lengths that they go to, right? But this is a sign, I think, that we're winning. And for me, as well as obviously working for public health, I was, it's hard to do this stuff. It's hard to, let's just establish this right now. It's not safe to speak. But it's even less safe to not speak. Because whatever risk you're avoiding in the short term is only going to get bigger as we move forward. And, helping overturn the NHS vaccine mandate for me gave me great kind of, it was just very heartwarming because people reached out to me. There were nurses, doctors crying. We overturned it, and it was one of the nicest messages that I got from a nurse. Said, "You saved my job," right? And this is what we're talking about. We're really fighting for humanity. What can we do? I know I'm overrunning, so I'm going to be very quick. Very simple things. Drug companies can develop drugs, but they certainly shouldn't be allowed to test them and hold on to the raw data. The drug regulators should not be taking money from industry. We should all say that. It's not acceptable anymore, right? These have all happened because of undemocratic, unscientific, unethical laws, right? I believe in democracy. This is not democratic. So what do we do to counter the corporation? The field of public health needs to refocus our research programs, reframe our way of thinking, and disconnect our programs in terms of industry, and then we need to redesign the corporation. Abraham Lincoln predicted this. This has been, a journey that with peaks and troughs over the last couple of centuries. I see in the near future a crisis approaching that unnerves me and causes me to tremble for the safety of my country. Corporations have been enthroned, and an era of corruption in high places will follow. And the money power of the country will endeavor to prolong its reign by working upon the prejudices of the people until all the wealth is aggregated in a few hands and the republic is destroyed. Let's go back to what it means to being human. We are battling here. The battle is between truth and money, between what it means to be human and what it means to be a sociopath. Right? Ultimately, this is what's driving our culture. Our culture is also going down the wrong track. We are heading in the wrong direction. The late Robert Kennedy, right? The gross national product does not allow for the health of our children, the quality of their education, or the joy of their play. It does not include the beauty of our poetry or the strength of our marriages, the intelligence of our public debate, or the integrity of our public officials. It measures neither our wit nor our courage, neither our wisdom nor our learning, neither our compassion nor our devotion to our country. It measures everything, in short, except which makes life worthwhile. So let's talk about being virtuous. Let's be more courageous. Let's go back to basic human values first and foremost. From that, knowledge will develop. It will mean that we're also more open to being vulnerable when we get things wrong. Things change. People accept that we can make mistakes. Let's be honest about them. And courage is the most important of all the virtues, because without courage, you can't practice any other virtue consistently. Let's remember, as Gandhi said, it is health that is the real wealth and not pieces of gold and silver. Right, let's rise up against this organization of misery. And last but not least, rights are only won by those that make their voices heard. Hope is never silent. Thank you very much.